My name is Mark Darrow. I practice Prolotherapy. I've treated thousands and thousands of patients over the years. The reason I do Prolotherapy, it worked on me and it works on my patients. Prolotherapy is a surgical alternative that reduces or eliminates pain. We inject the area of the injury, typically with dextrose and lidocaine, to stimulate an immune response to bring cells to the area and rejuvenate the tissue. The advantages of Prolotherapy over surgery are many. Number one, it's less invasive. Number two, it's less expensive. And number three, there's virtually no recovery time. The video you're about to see contains Prolotherapy in action. If you have any questions, feel free to contact me at 1-800-REHAB-10 or my website, www.drdarrow.com. This patient is a 43-year-old tennis player. She's the captain of her women's tennis team. She came in suffering from what we call tennis elbow, lateral epicondylitis, and about a duration of maybe 7 months, I think it was. We're starting to inject her, as you can see, on what is called the lateral epicondyle, and that's where the extensor tendons attach to the elbow. These are tendons that assist in raising up the hand and the fingers. What we're doing here is injecting with a 30 gauge needle, which is about as small as you can push a solution through. And as you can see, this is very simple to do. She tolerates it very well. And we're hitting the annular ligament, which often is a source for pain also. Now what I can do is use my thumb to find out the spots where the pain is coming from and then inject directly onto those. And this is a procedure that's very easy to do, very well tolerated, and the healing usually takes place in about 3 to 4 weeks. As I've mentioned before, my technique with Prolotherapy is typically done once a week to get the quickest amount of healing to take place. The most common way of treating tennis elbow is with a steroid injection. Most people call it cortisone, which is a type of a steroid. And what that does is actually weaken the attachments of these tendons to the bone. I had one patient come in who was a tennis player, and over the years she had approximately 16 steroid injections in her elbow. When I found her, she could not even extend her wrist backwards because the tendon was so weak and there was so much pain. We started Prolotherapy, and it took about 2 months of injections once a week to actually rebuild that tendon and make her pain-free once again. Most people don't have that done, and it's a very simple procedure, just starting Prolotherapy, which is really the best way of healing this area. The steroid injection sometimes works for a while, but then typically fails after some time after the injection.